action. What is up, Travels with Buddy Nation on the Travels with Buddy station? Today is Tuesday, and we are almost at the end of March. We're heading into April, springtime weather. Spring is coming close, and the weather's getting better. And today I would like to talk about the dangers of steroid use. I know if you've been watching my videos, you know that I do a lot of weight training and I do a lot of working out. But one thing I don't use steroids. I've always been against steroids, and for me, it's not worth putting on a couple of pounds of muscle for all the health risks that are required when you do, or that happen when you do steroids, or potential health risks that are involved from doing steroids, I should say. And I'm just that's just my opinion on using steroids. And I will briefly go over some of the dangers of steroid use. Anabolic steroids, androgenic steroids, are synthetic substances that mimic the effects of testosterone in the body. While they may have some legitimate medical uses, they also come with a wide range of potential dangers and risks. And here are some of the dangers associated with steroid use. Again, I'm not knocking anybody if for using them. If that's your thing, just know the risks that are involved. And there are many risks involved in using steroids. Physical health risks. Steroids can have numerous negative effects on physical health, including liver damage, cardiovascular problems, such as high blood pressure, and increased risk of heart disease, and adverse effects on cholesterol levels. They can also interfere with normal hormone production, leading to hormonal imbalances and potential long-term damage to the endocrine system. Also, psychological effects. Steroid use has been linked to mood swings, aggression, irritability, and behavioral changes, commonly referred to as roid rage. Like Buddy gets roid rages if I forget to feed him on time, he'll have a roid rage. No, just kidding. If you know Buddy's my Bichon. Users may also experience increased anxiety, depression, and even psychiatric disorders. And I've seen that in gyms. I've seen guys just go bonkers just from being on the juice. It's also addictive. Addiction and withdrawal. Prolonged excessive use of steroids can lead to dependence and addiction. Abruptly stopping steroid use can result in withdrawal symptoms, including fatigue, restlessness, mood swings, and depression. Virilization and feminization. Steroid use can cause irreversible physical changes in both males and females. In females, it can lead to masculinizing effects like deepening of the voice, growth of facial hair, and baldness, and changes in menstrual cycles. In males, it can cause testicular shrinkage, reduced sperm count, impotence, and breast enlargement. Hormonal disruptions. Steroids can disrupt the body's natural hormone production, leading to various complications in males. This can include testicular atrophy, decreased sperm production, and reduced testosterone levels. In females, it can cause menstrual irregularities, infertility, and masculinizing effects. I mean, some guys like women that are masculine, so, whatever. But these are the side effects, so just know them, if you ever decide to use them. Organ damage. The misuse of steroids, especially at high doses or with prolonged use, can lead to damage to various organs, including the liver, kidney, and the heart. And also, last but not least, legal implications. Steroids are illegal. They are classified as controlled substances in many countries and are illegal to possess or sell without proper prescription. The illegal distribution and possession of steroids can result in legal consequences. So that's another issue. They are illegal unless you do get them from a doctor. And even if you get them from a doctor, they still have potential risks. Just because you're getting them from a doctor doesn't mean that you're going to be perfectly healthy for taking them, and you got to be careful about taking them. It is also crucial to emphasize that the dangers of using steroids can vary depending on factors such as dosage, duration of use, individual susceptibility, and the presence or absence of medical supervision. If you are considering any form of steroid use, it is essential to consult a qualified healthcare professional for accurate information and guidance to ensure your safety. So there's a lot to, think about if you're ever thinking about using them, and know the risks involved. And that's just a few of them, and I'm sure there's a lot more. And for some people, they're more dangerous than others depending on your susceptibility and if you have any prior health issues. Me personally, I'm a natural lifter. I've always liked to train natural. I just feel better and I feel healthier when I train naturally. Yeah, I might not be as strong as some of these guys on the juice, but anyways, I feel like I feel much better about myself. I feel healthier training natural. So just letting you know the warnings of and the dangers of using steroids if you ever think about using them. And the safest way, the safest alternative is, in my opinion, is to not use them at all. All right. And remember to keep training, train naturally. And if you like these videos, make sure you subscribe to Travels with Buddy. And also remember to keep taking those walks and have an awesome day. All right, everybody. Peace out.